there are really three main stages when we're talking about a COVID infection. And the first is that primary infection stage. And what happens is for as many as 5, maybe even 7 or 8 days, individuals who are infected can be asymptomatic or minimally symptomatic, where they have some mild cold type symptoms and don't even know that they have COVID-19. And I'm going to use the term COVID-19 and SARS-CoV-2 interchangeably. SARS-CoV-2 is the virus and COVID-19 is the disease, but they essentially kind of, for the purposes of this discussion, mean the same thing. So it's during this early infectious stage where if you get something beyond being asymptomatic or beyond getting mild cold symptoms, you may develop things like fever, runny nose, sore throat, headache, muscle aches. In about 10% of patients, they get some gastrointestinal symptoms. And then for people who go on to get more significant disease, it then becomes more of a pulmonary disease where you can develop cough, sometimes some phlegm production, shortness of breath. And then after that, it becomes more of an inflammatory thing where it's gone from the virus kind of causing your symptoms to your body's immune system overreacting to the virus. And it's this actual big immune response that causes a lot of the problems that we see, where people get these terrible effects on their lungs and this condition called ARDS, although we can talk more about that because that's being called into question. And you see on x-rays and CAT scans this kind of white out pattern. That's all. And then also those who go on to develop organ failure with liver failure, kidney failure, cardiac conditions, those are all a result of the body's overactive immune response. So of people who get infected, about 80% or so get minimal to kind of mild symptoms. It's kind of flu-like symptoms. And I want to make sure we differentiate flu from COVID because they can produce in the early phases similar symptoms, but they're very different viruses. And it's then that you move into that lung phase. And Mary, you brought up this point about their oxygen status. I'm happy to dive more into that. It's really acting differently than almost any other disease we've seen in the past. But it's this early asymptomatic period that's making this disease so difficult to get on top of, and what has led to, it was a delayed response on the part of our country and this early asymptomatic phase that's really led to this large-scale quarantining and social distancing that we're seeing. We were talking before this morning about the difference between SARS that we saw back in 2003 and this current disease. And we were able to get on SARS very quickly because fever was very prominent early on. And so you saw all the airports setting up temperature scanners and people getting their temperature checked as they got off of planes. And if somebody had a fever, they got quarantined immediately. And so that kind of served as a marker of early SARS infection, and we were able to get on top of it and kind of suppress it that way. COVID doesn't have that, and it has this long asymptomatic period, which allows people to interact with one another and cough and sneeze and touch things and be out in public up until we shut things down. And so it was spreading very easily and undetected.